webinar speaker, Dr. Johan Malawana. Johan is the current CEO and founder of both Medics Academy and the Healthcare Leadership Academy. He is also well known as the former chair of the Junior Doctors Committee of the BMA and is the current lead for education and training at Healthcare UK at the Department for International Trade. Johan previously worked as an obstetrician before moving into medical entrepreneurship. He is also one of the most driven and professional colleagues I've ever worked with, and as a foundation year doctor myself, I'm incredibly excited to hear his talk on innovating in medicine during a foundation program. Is it even possible? If you have any questions during the webinar this evening, please post them in the dedicated Slack channel. The channel for tonight is #innovation and can be found on the FDoc Slack. Without further ado, over to Johan.
In this talk, I will try and work with you to think about some of the basics of innovation. If you are starting out in a career in medicine as a foundation doctor, after spending so much time getting into medical school, working hard at medical school, and getting through medical school, so many young doctors are coming out and seriously thinking about becoming entrepreneurs, looking to join the wave of entrepreneurship that is sweeping across many industries. Since this talk is specifically aimed at foundation doctors, as they are starting to think about the rest of their careers, the most important point I want to get across to you is that being a doctor is still, and always will be, one of the best jobs in the world. It is a vocation that you should cherish and be proud of. It is also an incredibly rewarding life. Innovation does not mean giving up on life as a doctor, and in this talk I will talk about how you can think about innovation in healthcare. Let's start with what does innovation mean? Innovation is defined as the introduction of new things, ideas or ways of doing something. Innovation in recent years has been tied up with thinking about technology and the startup ecosystem. However, clinicians have always been innovators, and innovation has been the cornerstone of medicine. Medicine at its heart is a scientific endeavour. Having a hypothesis and using experimentation and evidence to prove or disprove that hypothesis. Research and science have been the foundations of modern medicine, so being an innovator is nothing new. As a clinician scientist, you need to think about the world around you in healthcare and think about how you can solve problems. That is what an innovator is all about. Healthcare is full of interesting problems to solve. With the pandemic, there are traditional research and clinical scientists that are solving the greatest disease threat that has faced our societies in a long time. But they are augmented by clinical innovators in our hospitals and general practices all over the NHS, looking at the problems faced in delivering services and coming up with novel solutions to delivering healthcare. That could mean thinking of new ways of organising a GP practice with hot and cold clinics. That could be thinking about how we deploy staff more effectively. In my area of interest and work, that is how we improve the training of clinicians and increase the numbers of clinicians trained to meet the demands of healthcare systems. My advice on being an innovator is look at the healthcare system you're working in and think about how to improve it. Often early stage doctors tell me that they are so frustrated by the system as there's no way of changing it, and improving care for the patients they have dedicated their professional careers to looking after. I encourage all healthcare professionals to look at the possible improvements to healthcare as opportunities. When I talk to potential scholars wanting to join the HLA, I want to understand not simply the roles they held in their career thus far, but what they did in those roles. I want to see that innovative thinker and thinking. So how do you think innovatively? First, never accept that systems cannot change. Even large, complex systems like the NHS have to change and are constantly doing so. Be passionate about the change you want to make. Passion and determination are incredibly powerful motivators. I ask virtually everyone I ever interview whether they are ambitious to change the world. Ambition is often thought of as negative, but the reality is that ambition itself is just the desire to do something or achieve something very much. So being determined to succeed at the task, objective or goal you set yourself is a vital characteristic of an innovative person. Focus is really important. Find something that you really care about and be known for focusing on that. As medics, you understand how finding your specialty is often really important. In the same way, if you want to be an innovator, spending time really focusing on a problem will help you solve it. If you are constantly moving from one problem to another, but you aren't completing a solution to a problem, then nothing moves forward. I found the difference between innovative change and entrepreneurial change was knowing when to come back to solving a problem, as I needed to solve many different problems, and often some needed solving more urgently. Giving up on solving a problem is not helpful, but when you have a complex series of problems to solve, taking periods of time regularly to re-look at the whole situation is important. I would often reorganise the order in which the components needed to be solved, and found this sometimes to be really useful. Breaking complex problems down is really important to realise that complexity is not a barrier to innovation. It can often be the reason for innovation. The breaking down of a problem into smaller, manageable parts can help to find ways of making improvements. A simple technique for this is called process mapping. So, looking at something really complicated and breaking it down into a series of steps. In doing so, you can understand the dependencies across a complex system and then think about whether there is an inefficiency in that system or improvement that can be made. Don't try and reinvent the wheel. The easiest way to be an innovator is not to come up with something new. Often it is impossible to come up with something truly new. It is much easier to find solutions that work elsewhere and simply apply it to the situation you face. I often find healthcare organisations and professionals try to do something from scratch that you can find incredible examples already in existence. In healthcare, we love creating new and complex solutions to problems. Innovators will often find simple solutions that already exist and try and adapt them. This often saves a lot of time and a lot of resources.
Hi everyone, I'm Pedro Rabi'i and I'm the hlalive lead. So, what is hlalive? I don't think even I know. hlalive is a weekly webinar series that hosts conversations with interesting people across healthcare and a wider society. Thank you, Google. But seriously, hlalive is amazing. It's not gonna work.
Hello and welcome to hlalive. This is the 6th episode of hlalive.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hello, I'm Alistair. I'm a final year Newcastle medical student and a scholar of the HLA. I'm very interested in surgery and I will be one of your hosts this evening.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
Hi,
My name is Jess and I recently graduated as a doctor.
We'll start while everyone else ponders, because that way they can give better answers than me.
My heart is full of joy this evening, really. And I have my granddaughter with me, and my daughter. I haven't seen them since February.
Oh gosh.
So I will be telling them about this event. My granddaughter.
Quite quick, we have ideas, let's do this, let's do that. So we said, let's launch Straighty Direct, and within 3 months, we thought we would be on the market. So that was a bit crazy. But actually, we did a pre-launch within a few months, just to kind of, with a simple quiz capture, just to kind of gather some data.
It's a big question, and I'm a bit worried that you've got like 3 minutes before we're going to start this. Cool. We're clear. Well done, everyone. That was really cool. That was really powerful. And there were so many really good points made.
So how do you innovate in an organisation whilst being a junior doctor? How do you be an intrapreneur? For those that haven't heard the word or the term intrapreneur, as the word sounds, it's basically a mashup word that means to be an entrepreneur or think entrepreneurially inside an organisation. Often this type of member of staff is one of the most valuable members of staff in an organisation or team. Importantly, they can be found at any level within it, and anyone leading in any way within an organisation should be constantly looking out for this person and making sure they nurture them. Senior, talented people love problem solvers. Being the person that doesn't just give you a list of everything that is wrong, but identifies a problem and then comes up with a solution, that is gold dust. So whenever I have seen someone like that working in an organisation, I've found that they are the person the organisation needs to be making the most of. For virtually everyone, especially junior doctors, don't wait to be asked to come up with a solution. Don't go and talk about a long plan you have made, especially one that involves a huge amount of budget or lots of other people doing work. If you are truly an innovator, look at the problem and then find a solution that partially solves the wider problem alongside a clear plan to solve the whole problem. In the wider context of entrepreneurialism, we refer to this method as the minimum viable product, or MVP. Even if the solution is not perfect, deliver that solution and then go and demonstrate it. If you can show you have the motivation to solve the problem, then it is so easy to make the decision to support you to either improve your solution or to give you more resources to find a better solution. Talk to people, create networks within the organisation. Do not be insular or elitist. Healthcare is a very hierarchical institution, and this can be a major detriment. Innovating in an organisation often requires knowledge that can be spread throughout the organisation. So the greater your network, the greater the spider web of knowledge you may have to draw upon. The more likely you will find the black swan piece of information that will help you solve the problem you are trying to solve. Allies within and across any organisation are invaluable to you being successful.
Hi, so my name's Zaid. I am an F1 in West London, and I just completed the Medics Academy Training and Teaching Day 3 course.
I think it's structured in a really nice way with a lot of resources you can permanently access. The course isn't over after 3 days. You've got a ton of online content that you can always revisit, and I think that is fantastic.
I thought it was a great way to learn through having a full day at the start and then 2 later days of self-study. It really allowed for flexibility and allowed us to fully engage in the course.
It also made me feel better prepared to deliver teaching remotely or digitally.
It's really interactive. There's a lot of small group feedback session, exchanging ideas and learning people's perspective.
After actually doing this course, I realised that teaching is more of a science, and it's really important to get clear feedback so that you can improve your teaching.
This course also encouraged me to think thoroughly about what my audience actually wants from my teaching session, and also how I can keep them better engaged.
Really great and fantastic to get such fantastic lectures from experts in the field throughout the 3 days. It was also interesting to learn from others taking part on the course, because we all have different levels of experience, so it was interesting to gain their perspective on things too.
I learned not just about different style of teaching, I also learned about what is medical education, how to build a career in medical education.
Overall, I learned a lot from the teaching course.
I think it's a really well done course.
I really enjoyed it, and I really found it very enjoyable.
That's what I thought of the whole course, and I really enjoyed it, and I would recommend it to other people.
So thank you for letting me participate.
Doing your own thing. This is a common thing for doctors. So you think you're innovative, perhaps a bit of an entrepreneur. Currently, the biggest leap people consider is should they go and start a company with their idea. Statistically, this is a bad idea, simply because the stats say that over 90% of people that even bother to go and do this, not just the people that think about it, but actually do it, fail. Do you like to fail? Most clinicians hate the idea of failure and rejection. You have to develop a love and enjoyment of filling out spreadsheets and learning how to go sell, whilst being constantly rejected and told to go away. There is often a huge difference between innovating and actually starting a company. For a lot of junior doctors, they don't really want to leave medicine. What they want is actually just a little more control, autonomy, and to be treated with a bit of respect. Something that is rarely discussed in the world of entrepreneurship, as the focus is often on financial returns, i.e. money, is, as well as scaling and creating a sizable organisation, is that sometimes what you actually want to do is build a small lifetime pursuit alongside your clinical career. Traditionally, this is what some clinicians did when they did private practice, or pursued being an educationalist, researcher, or did some management activity. Now, there are so many opportunities out there to create these portfolio careers. As someone interested in innovation, I would encourage you to look at different models of how to create yourself a portfolio career. In Medics Academy and the HLA, we have a lot of clinicians that take on roles so they can build portfolio careers and gain skills. The advantages of smaller organisations, whether they are commercial companies, charities or social enterprises, is that usually decision making can be less bureaucratic, and organisations can respond in an agile way to opportunities that present themselves. At Medics Academy, we have repeatedly done this, whether it is the creation of the HLA, creating the FDocs programme, the SDocs programme, or working on a variety of partnerships with national and international organisations across healthcare. All projects will either be led by clinicians or involve clinicians in the senior decision-making team. As an ecosystem and organisational culture within both Medics Academy and the HLA, we focus on how to upskill clinicians and create for them opportunities to create those flexible careers they often desire. These are both clinically led organisations, with extensive numbers of clinicians involved at all levels of the organisation, making decisions, driving forward innovation, and thinking about how to improve the healthcare system. If you are going to start something yourself, there are so many programs and opportunities out there to support you in that journey. Within the NHS, there are innovation and entrepreneurship programs. There are also a lot of programs outside the NHS. It is often worthwhile accessing information early in the process of setting up an organisation. Once you've set up an organisation, the next stage to start looking for a lot of support is much later, when you are at the point you're basically overwhelmed with interest, users or partners. Usually at that point you are overwhelmed due to the success of what you are doing. You have clearly found an audience. If you're looking to start a not-for-profit social enterprise or charity in healthcare and would like the support to do so, then it is worth thinking about HLA Ideas. It is a programme that is fairly unique, catering to this specific audience. Social enterprises, not-for-profits and the charity sector are rarely given the same organisational support due to not having the resources to recoup that investment. Therefore, the HLA and Medics Academy committed over £50,000 to set up HLA Ideas, as so many HLA scholars were coming up with fascinating projects that needed this support to scale them up and to become self-sufficient, sustainable organisations. So, my general advice: understand how resources work so you can find ways of sustaining your solutions. An area I'm always trying to make clinicians take a greater interest in is being economically and financially literate. Understand how resources work, how are projects funded, how do projects in your organisation gain the resources they need to become sustainable. Think about what the objectives of the organisation you're in may be. Think about how you would align those objectives with what you are trying to achieve. Think about how you demonstrate that alignment so you make it easier to make your project succeed. Think about how a decision is made. Healthcare is full of bureaucracies. How decisions are made are often opaque. So understand the decision-making process in an organisation you may work in and plan strategically to present the relevant information to the relevant stakeholders at the right time. You can often fail to move something forward for not having the right information, as well as in some cases overburdening a process with too much irrelevant information. Therefore, the required need to make a decision is hampered by that overburdening. If you set out to create an organisation yourself, to move your project forward, you must be financially literate. You need to be aware how you're going to get the resources you need to make your project work, how to sustain that project, and the reality of the costs associated and the risk you are potentially taking. Have very clear understanding of the risks involved so you don't find yourself in a difficult situation. As a foundation doctor, you are on the front line of the NHS. You're moving around so many departments and seeing so many different examples of delivery models, healthcare systems, and organisational activity. For an innovator, this is the equivalent of a lifetime of experiences that a writer would take advantage of when writing books. There are so many things you're surrounded by and are seeing that you should try and look and think how you can improve. You'll be tempted to be demoralised by the sheer overwhelming nature of the healthcare system at times. I spend so much of my time working with clinicians that feel like this. As an innovator, look for the inspiration in all these experiences and think about how you will affect change. If the pandemic has taught us anything, it is the NHS is full of incredible innovators and inspiring professionals. You can change the system, and you definitely can change the world. You just need to break the problem into one problem at a time and solve them.
Thank you, Johan. That was awesome and a great insight into what you can do to be inspiring during the foundation programme. Please do post your questions in the dedicated Slack channel if you want to ask Johan anything. Our next speciality talk will be an insight into palliative care by Dr. Seaman, a palliative care consultant based in Cardiff. Please look out for our future speciality webinars and other materials produced by Medics Academy and the FDocs team.